So stem cells in shoulders, you're optimistic and you say you get great results. So how does it work?
So the most common indication or the most common patient that I see, rotator cuff tear.
Okay.
So imagine the muscle or one of the four muscles that help you move your shoulder rotated is torn. Let's say it's completely torn. A few years ago, this would be automatic surgery to put it back together with stitches. And that recovery is sometimes up to 6 months.
Okay.
What can we do differently? Stem cells. So we can inject stem cells in the muscle, in between the two pieces of the muscle that are separate, so that the bone marrow stem cells that we're putting there help regenerate and reconnect that muscle.
So this rotator cuff, it's a tear, right? Of the rotator cuff.
Yeah.
And it separates, as you just said. And when you inject it, the body just automatically repairs it or brings it back together? Is that kind of what's happening?
Like when you have a cut, your skin is separated, it regrows itself. We just help that do it a lot faster because it's a race against time. If you don't fix it quick enough, the muscles will continue to separate. So that's why you want to actually do the stem cells.
So you love shoulders. I mean, you like doing shoulders with stem cells.
Yes, because we're preventing these patients from surgery and they can go back to doing their sports or weightlifting, a lot of things that they cannot do because of that shoulder problem.
Okay,
Golf.
And we should mention, because stem cells is a loosely used word, there's prolotherapy where they inject sugar, as you mentioned. There's PRP from their own blood, spinning it, putting it in there. Do you try those things first and then you go to the stem cells? Or it just depends on the condition?
It depends on the condition. So if it's a severe tear, then we have to go with the stem cells. But if it's a partial tear, for example, we don't need to do stem cells. We can do PRP. Or if it's a tendonitis rather than a tear, we can do prolotherapy. So yeah, we have options.
So you are able to just take a little bit of stem cells from their hip, and then what do? Prepare it and then inject it?
Exactly. We concentrate them. We count them first, make sure that we have enough cells, and then the lab processes them, concentrates them, and then we inject it precisely where the tear is so that it can do its job.
You say this is the future?
Absolutely. This will replace a lot of surgeries, the future of pain medicine and orthopedics.
And once insurance starts covering this, then it'll blow up. Do you believe that?
That's the main barrier right now, is that it's not covered by insurance. It will. It's just that the insurance is behind the science by 10 years probably.
So the people in the know are doing this?
Exactly.
Like athletes, pro athletes, things like that. And like I told you, I was told that the shoulders don't treat so well, that it's really the knees that treat well. But you say you have data from Regenix that shows that shoulders treat great.
They treat great, yes, absolutely.